Hey everybody, how you doing? Today we are at TriStar Stonecrest Medical Center in Smyrna with Dr. Shibayama, who has very graciously donated your time. We know you're very busy, you got lots of surgeries going on, thank you. But we were here a little bit ago and you had told us about a program that actually you started that I really wanted to bring out to the public's attention. So thank you for doing this with us, and it's all based around alcoholism. So I know it's a touchy subject sometimes to talk on, and so I really appreciate you going into depth with us on this one, so thank you. But before we get into that, Dr. Shibayama, I can never get your full title right here. It's the hospital so long. So what's your full title here?
As my regular job, I'm an orthopedic spine surgeon, but I'm also the medical director of the AA recovery program for HCA TriStar.
Gotcha. And as general HCA, right? All of HCA, yeah. And you started this program.
Yes, we started it about 3 years ago, actually.
3 years ago?
Yeah.
Nice, okay. And then you started it, if you don't mind kind of go into the backstory a little bit. I know it's a very personal thing.
Sure.
And if you don't mind sharing.
Yeah, well, so as part of my story is I'm a recovering alcoholic, and I went to rehab in 2015. But for 2 years leading up to that, I knew that I had the disease of alcoholism, and alcoholism is defined as continued use in the face of adverse consequences. So it's not about frequency or duration or volume. It's if a person drinks and they have an adverse consequence and then they choose to drink again and they repeatedly have that behavior, that qualifies as a disease of alcoholism. So me being a physician absolutely knew that I had the disease, because even though I would only drink on weekends and vacations, the consequences kept getting worse and worse and worse. And yet, so for 2 years leading up to 2015, I knew I had this disease, but I didn't know what to do about it. And alcoholism is a disease, like you said in the beginning, people say it's a touchy subject. It really doesn't need to be a touchy subject. It's a mental health disorder. It's no different than depression or anxiety. You know, those are diseases that people kind of go to the doctor and they want them to say you're depressed, so you need this. But, you know, God forbid a doctor says, well, you're an alcoholic. Well, they get all offended. Well, it's a diagnosis. And so it's as simple as that. So for those 2 years, you know, I did not know what the solution was. And me being a physician, I would have thought that I would have known the best treatment for the diseases that I'm treating or that I see. So long story, I went to rehab, and then after that, and then I started going to Alcoholics Anonymous, otherwise known as AA. And in 2020, in March of 2020, there was a major medical study that was a meta-analysis of 27 other studies, over 10,000 patients, that looked at the best treatment for the disease of alcoholism. And it definitively found that Alcoholics Anonymous is the most effective treatment for the disease of alcoholism. So there's scientific evidence behind this, and not only in that, this is what I experienced. And so when I found that study, I was perplexed as to why is not every doctor prescribing this? Why doesn't every medical professional know this? I mean, if we knew what the best treatment for cancer was, every doctor would prescribe it and every doctor would know about it.
Absolutely.
And yet with this disease of alcoholism, people just didn't know about it. I didn't know about it. And, you know, in the hospital, we have all these patients that come in with alcoholism and addiction. It's also effective for addiction. That we treat their liver failure, we treat their GI bleeds, or all of their medical conditions associated with the alcoholism, the mental health disorder, but we don't do anything for the root problem which has brought them here. And that's when I decided, we really need to do something about this. And this was also during COVID. November 2020 is when we started. And this is when virtual meetings, before that, people didn't really know about that. And I thought, well, if we can have a virtual meeting and we can bring the iPads to the patients so they don't have to go anywhere, we can start prescribing this and they can start getting treated in the hospital right away. And so that's what we did.
Awesome. And if you don't mind, I really want to reiterate on that one part that you had said, just so people know, because I know when we started talking, my thoughts and pictures of alcoholism and alcoholics was drastically different than what I thought, because I'm picturing somebody that was drinking all day, every day, 24/7, that sort of stuff. But it's just somebody that drinks, how did you word it?
Continued use in the face of adverse consequences.
Okay, so.
So what people typically think about is major financial consequences or major health consequences. But, adverse consequences, the earliest signs of alcoholism are broken relationships, and family relationships and things like that. And people don't think, well, the alcohol is contributing to that. Well, most of the time it is. And so people don't want to think that way. But negative consequences don't have to be these drastic major things that people think about, like financial ruin or losing your job or losing your house or things like that. So like in my life, my negative consequences were primarily with my family.
Yeah.
And, I knew that I was not being present as a husband, being present as a father, and I was not parenting the way that I should when I was home. And so those were the negative consequences that were happening. So, a lot of people, one part of the reason I started this program too is I want people to decrease the threshold for their diagnosis of this disease. These bad things keep happening to me, and they typically happen to me when I'm drinking. And so maybe I have this mental health disorder, this medical problem, and maybe I need to get treated for it. There was one guy in a meeting who said this. He said, I'm not really sure if I'm an alcoholic, but every time I drink, my life gets worse, and every time I don't drink, my life gets better. Well, I mean, that's pretty obvious. Like if you've made that correlation in your mind, you have a problem with alcohol, you probably have the disease, and it's just a disease. So just go ahead and start getting treated. Go to AA on a regular basis, and and a lot of people will get better.
Yeah. Now I'm curious, true or false? I heard this, and I want your opinion on everybody. I read online that's saying that everybody pretty much out there watching, listening, has either directly or indirectly in one way been affected by alcoholism.
Absolutely.
Or they know somebody who was, that sort of thing.
Absolutely. I mean, and the data shows that since the pandemic, 1 in 5 deaths, ages 25 to 49, is directly attributable to alcohol. I mean, think about that percentage. And, it's talking about the negative consequences. I've never seen alcohol put a family back together. I've seen alcohol tear a bunch of families apart. And so, there's a lot of people that have negative consequences, but they don't want to attribute it to alcohol. They don't want to think that they have this problem. Well, nobody's really all ashamed if they're diagnosed with diabetes. Well, you have diabetes. Okay, well, so now let's treat it, that's what my goal is, to try and get people to understand that this is just a disease and that we need to treat it.
Yeah. Do you see a lot of pushback sometimes from people that, like, if it gets brought up that they may possibly have an alcohol drinking issue or alcoholism?
It's variable. I mean, it's variable through the people that I see at the hospital. Gotcha. And I can tell when I talk to people in the hospital, my first question usually is, can you tell me what brought you to the hospital? And so most of the people who have an awareness, they say, well, I'm having these issues because of my drinking. And then the people who have no awareness of it say, I have all these medical issues, this GI bleed, this throwing up, this diarrhea, I've got this body swelling, and I'm yellow, and nobody knows what's going on.
Okay.
And so then I have to explain to them, well, most of your medical problems are related to alcohol, and you're having negative health consequences as a result of this. So we need to treat those medical things, but we also need to treat your alcoholism.
Do you see, like, with all those stuff that you just mentioned, is there like a series that kind of, like, the symptoms that start, is there one that hits first, one that hits second, or anything as far as the physical side?
Not really, no, but
the
most common complaints in the hospital are usually GI symptoms.
Okay. Okay, gotcha. So, all right, so that started all back, you said in 2015 originally?
Well, I went to rehab in 2015.
Okay.
I started this program here in 2020.
2020, okay. Yeah. I got you. But I'm curious, it sounds like it's been really well received, especially by the hospital and HCA in general.
Oh, yeah, HCA has been fantastic.
So you started and brought it to them, and they said, let's do this?
Yes. Well, I went to the hospital, and they were very supportive. And then once we started the pilot program here, we started moving forward with that. Then the chief medical officer for all of HCA, TriStar, caught wind of it too, and she was very interested in it. And so then we started offering it and making more like materials that can be distributed at other hospitals, and getting the program more streamlined so that it can be packaged and taken to another hospital so that they can do the same thing.
That's fantastic. Yeah. Oh, I love that. Okay, so that was 2020, and it, like you said, all the hospitals pretty much.
For HCA TriStar, yes. And then I will say, in 2022, I had the opportunity to present at the National Trauma Quality Improvement Program Conference. And this is a conference for all of the trauma centers across the whole United States. And because people who treat victims of trauma know that very frequently, alcohol is involved. And so they really understand, like, we can treat their fractures and we can put them back together again, but if we don't do anything to treat their alcoholism, then they're going to end up right back here in our trauma bay. So they were very receptive to that, and so I was able to present there, and I've spoken with several people at many different facilities throughout the United States. Now I kind of help, I give them information and tell them what we're doing, give them some of our materials. But I don't have enough bandwidth to keep following up with them. But I know like throughout the country, it was very well received at that meeting. And so, and like I said, my vision is that this should be at every hospital in the country. I mean, we treat every disease when somebody comes in the hospital. So why wouldn't you treat this disease?
Yeah. Did you ever see that? Like, did you picture that in your mind when you started the pilot program? Like, hey, let's do this here with this broader, and it just exploded. And now you're on national conferences thanks to TriStar and everybody. And what was her name? Lady helped you out.
The chief medical officer.
Chief medical officer. Thank you, by the way. She's watching.
Yes, that's Dr. Vandekar. Thank you.
All right. Yeah. So did you see it going that big, that fast? Or?
I didn't. Well, I didn't know how long it was going to take, but I mean, at some point, the physicians know that this is a disease and that we need to treat it. And so, my hope, my vision was that it will be at every hospital throughout the country. It'd be the same thing. Like if there was a certain type of cancer, everyone knew what the best treatment for it was. Then you would think every hospital in the country would prescribe it. So that was my goal.
Okay.
So it's getting there.
So the pilot program, did that start here?
That started here, yes.
Right here at TriStar in Smyrna?
Yes.
Oh, very cool. Okay. So kind of walk us through that. How did that all start? How did it get ramped up?
Well, yeah, so there was a lot of moving parts to that.
I got you.
So, but, typically for here, since, I'm the medical director of the program and, it was my idea. So we created an order in the computer so that the doctors can order it. Just like if a patient has diabetes, you order this medication. If they have pneumonia, you order this antibiotic. If they have alcoholism, now you order this program. And so we got iPads that are on carts that go into the patient's rooms so they don't have to leave the room. The nurse can just start the meeting. And then I typically will go talk to the patient. I'll give them the book that the program is based on. It's Alcoholics Anonymous. It's also known as the Big Book. Okay. And I give them a book and I just kind of explain to them, just like I'm explaining to you, that this is a disease. It just needs to be treated. It's a chronic, progressive, fatal disease. And I analogize it a lot of times to other chronic diseases like diabetes.
Yeah.
Like if you're diabetic, you can't expect to take your insulin once a week and expect that your blood sugar is going to be controlled. Similarly, if you're diabetic, you don't take insulin for 3 months and say, I'm good now, I don't think I need this anymore. It's AA is the medication for this disease, and people just have to what we recommend initially is 90 meetings in 90 days.
Okay.
And if they can go to 90 in-person meetings in 90 days, and by my experience and observation, I've never seen anyone fail who has started on that path and committed to that kind of commitment. Although I can tell you there's very few people that make exactly 90 meetings in 90 days.
Okay, got it.
So, the media doesn't portray AA very well. And most things that people see about it are negative. However, the medical evidence shows that it's the most effective treatment for it. And so I'm trying to reduce that stigma too, that, this is just the medication for the disease. And so it takes some convincing to get people to take their medication. And then people say, well, it doesn't work. Well, if a person only takes 10% of their medication, do you think it's going to work? Yeah. The problem usually is not with the medication. The problem is with compliance. And that's really the major problem that we see with alcoholism, because it's a disease that tells people they don't have a disease, that they're fine, that they don't need any help, that they don't need any treatment. And so they have a hard time accepting that they have to take this medication, go to this meeting every single day in the beginning. But as we progress, at least from my experience, as you progress and you see it working, and my life, has gotten immeasurably better, since 2015. So that just keeps me motivated to keep going. And then I also hear stories in the rooms a lot of times. You hear people that were sober for 10 or 15 years, and then they stop going to AA meetings, stop taking their medication, and then 5 years later, they're worse than they ever were before.
Oh, no.
So that just keeps me motivated to remember this is a chronic disease. It does not go away, heal spontaneously, or remit. But I'm trying to get people to just understand that.
So, since starting and helping people through the program, excuse me, I mean, have you had people come up to you afterwards that have gone through this, that have just, with great success stories and how they pulled through?
Yes, absolutely. Yeah,
it's got to make you feel great. I mean,
it's the best thing when people, because the great thing about treating this disease also is not only does the individual get better, their whole family gets better, their whole social circle. Like there's so many aspects of their life that improve.
Yeah.
And other people's lives that improve. Because I should say this too, alcoholism is a family disease. It doesn't just affect the individual, you know, it affects the entire family.
Yeah.
So as that one person improves and gets better, the whole family gets better.
Yeah.
And it's great to see. Yeah, no, I love following up with those people, and we give out chips at intervals like 3 months, 6 months, and I've given out several 1 year, 2 year chips.
Oh,
and,
that's fantastic.
You know, to see, and it's amazing to see people's lives change.
Do you know how many people have gone through the program so far since it started?
We get about, the first year, about 500 that were introduced to it, and then you know, it's been more than that since then. And then, but not only that, you know, just from the nurses and the doctors knowing about it, there's people that I actually had a patient who her husband had seen me in the hospital, and you know, I had forgotten about it a long time ago, and so it just spreads through that way also.
Yeah. So because of your thought and your program and your experience, you've already helped out thousands of people.
Well, I don't know.
Yeah, well, it sounds
My
like
hope
it.
is,
I mean,
yes.
you started with a pilot program, and now you're on national stages presenting this to people through TriStar. I mean, it sounds incredible. I mean, you're helping so many people and families. It's amazing.
Well, my hope is, you know, me individually has helped people, but if each individual doctor, nurse, healthcare provider, family member, you know, just hears and understands, you know, the process of the disease is treatment, and encourages people to take their medication. And that's another thing for like family members who, you know, a lot of, you know, I talk to a lot of family members and they say, well, I can't get them to go and all this stuff. And I say, the best way to get somebody to go is to go with them.
Yeah.
Say, I'll go with you. You know, even though I may not have a problem, but I'm going to go with you. And that encourages people to take their medication and go. So, but, you know, just if you multiply me by thousands of people all over the country, I mean, we can make a significant impact on this disease across the country.
Yeah. Well, where the program is now, and where would you like to see it go, or where do you see it going in the future?
I'd like this to be at every hospital, like not just HCA, but every single hospital system in the country. You know, it's that would be my dream and my vision, and it's really not unreasonable because again, it's just a disease, and we just need to treat it.
Yeah, I got you.
We're physicians. We've been trained to treat people's diseases, so let's treat all of their diseases. Let's not just Band-Aid these things here and then get them out. You know, let's work on the whole person. You know, gets back to treating the whole patient and the spirituality of medicine, and really just seeing the patient as an individual, a whole person, and treating their whole person.
Yeah, I got you. Okay. Well, is there a place where people can get more information about this for me, or if they, you know, if they're interested, is there a website they can go to, anything like that, or?
Well, there's, like I said, I'm the medical director. If they want to contact the hospital, actually, I mean, I put my phone number out there for them, so I can put it.
Well, I'll put it in the description.
Okay,
for
put
you
it in
to
the
say that,
script. We'll put my cell phone number. I'm happy for people to contact me, and I can get them, you know, the written materials, the protocols that we have, and things like that to get it out. And yeah, but I'm happy to do that because, like, again, you know, this is a major. I would say alcoholism and alcohol is our #1 public health issue today in 2023. It is killing people, it's destroying lives, it's destroying families, it's destroying people's health, and it doesn't need to be that way.
Yeah. So for all those watching and listening and tuning in, so just kind of want to put it out there. If you think you are, because I know you said some people don't think that they suffer from alcoholism, like, oh, I just have a drink here and there, that sort of thing. But if you think you might have an issue, or based on everything you just said, please reach out. You can even reach out to us personally, message in on any one of the pages. You know, as to go out on a personal note, as you said, you know, this is everybody out there listening, watching has either directly or indirectly been affected by this. And I have family members myself who have been affected by this. And so if you need help, any information, you also reach out to us as well. And we'll put your information in the description as well. Thank you, by the way, for allowing us to do that.
You're welcome. And I'd like to say, you know, if you think, people think, well, for Alcoholics Anonymous and AA, well, I have to say I'm an alcoholic, or I have to know it. But the only requirement for going to an AA meeting is if you think you have a problem with alcohol and you have a desire to stop drinking. You don't have to say, well, you don't have to fully claim to have that disease. I would say if you think you might have a problem, go to a meeting and just listen and talk to some people. I mean, it won't hurt you to go to a meeting, and you'll get a lot more information. And if you find out you don't have a problem with it, great, you know. But I would just encourage people to go. You know, that the stigma of AA is been, bad in the media, but again, this is not my opinion. Like when I'm saying that A is the most effective treatment for this disease, this is not me just saying, this is evidence-based medicine. This is based on the medical literature.
Yeah. All right. Well, I'll put all that information in the description of the video, and I know we're short on time. I mean, you're in your scrubs. We're in the hospital. You got to get back to work. So, but thank you very much for your time. Really appreciate you talking and sharing your story and all this stuff. So, but again, if y'all need any information, anything, it's all in the description of this video, and just reach out. We'll be glad to help, or Dr. Shibayama will be glad to help as well. So, but we're going to end it there. I know you got to get back. So, thank you for your time. Appreciate everything, and thank you all for watching, tuning in, and we'll see you on the next one.